Let's expand the discussion on the latest from the Lagos State Government Public Health Physician. Dr. Jamiu Ganiu joins us now to talk about it. Thank you for joining us on the program.
Thank you very much.
Lagos State remains the epicenter of the COVID-19 pandemic in Nigeria. In its latest briefing on the pandemic, the government raised concerns about community transmission. How tight do you think restrictions should be, especially now during the festive season?
One thing I want us to understand is the fact that people are fatigued. You know, putting people at home for a long time. People have lost income through their businesses. People that enjoy festive mood, going to parties and so on, they're all adults. People are generally fatigued, and we have to really understand that. So for us to ensure compliance, there is need to create mutual trust. There is need to create that sense of belonging. There is need for government to kind of reinforce. This is the right time for us to sustain all the gains we made in the past through risk communication, proper community awareness, engaging the community. Because any restriction without proper sensitization may not actually work out. That is what is happening. That is why you could see a lot of things happening in many of the event centers. I watched what happened in one of the event centers on Euro yesterday, and I was literally disturbed. So before the reinforcement, government needs to resensitize the populace. Some people don't know about what we call the imminent second wave. We need to, step up our game, creating more awareness, let people know what is really happening, so that they can take it serious. People don't actually believe in what government is saying. So in terms of restriction, apart from restricting, closing some centers, especially event centers, talking about reducing the capacity of those that will be in one place or the other, there is need for proper risk communication. People need to be aware. People are tired, but we need to give them that assurance that it's just a matter of time, that we'll soon get back to our usual normal. So I think through that process, we can achieve a lot of results. And apart from the issue of community transmission, we need to look at where are we getting this. After August, we'll be having lower cases. Why are we having it now? If you don't reduce the import of this COVID-19, the virus, it will continue to be a bit of challenge. Sorry to say, I want to go into the epidemiological pattern. For instance, we're having people coming from countries where there are high number of mortality and morbidity, and we allow them into the country. Some of them present fake results because they're not showing symptoms, and what they expect, they mingle, they interact with other people in the community. In so doing, when they eventually develop symptoms, they either go to a pharmacy to get one drug or the other. And when it becomes serious, they start looking for where? A health facility where they can actually, seek for care. In so doing, they will have interacted with all these all sorts of people. And that is why we recorded about 20, maybe one of the reasons why we recorded 20 doctors that died last week, because of the issue of asymptomatic and so on. You don't know the status of that person. You may think just a normal malaria. You wouldn't know that somebody is coming with the COVID. So apart from the issue of community transmission, we also need to intensify surveillance at the port of entry. Our airports, we allow all sorts of people to come in, presenting all sorts of results. And when they come in, what will happen? They come into the community, and thereby spreading the virus. So we need to look at that critically, so that all these restrictions can actually work out. I agree some of the event centers have been closed, but they need to be properly sensitized. Some don't know about second wave. So I think those are some of the, things I could, that's my opinion as regards to why we are recording some relatively high number of cases of recent.
Oh, Dr. Ganiu, what other things, I know you mentioned so many things, but what other things you think the government can do to enforce these protocols?
We need to decentralize enforcement.
Okay.
What do I mean by that? We cannot have a state agency that is monitoring everything in the state. Just like during the when we had the first wave of the pandemic, let the local government, respective local government, have their monitoring team, so that at any time when there is any break in protocol, they can easily move to that place and address the situation. Because what's the point when the damage has been done there? We are now, in the closing event center. So when already people have get admitted, we are just waiting for the next 2-3 weeks for us to see the effect of what is happening. So I think they need to decentralize enforcement so that every local government will be responsible for whatever enforcement they want to in monitoring such restrictions. As you said already, in some of the eateries, event center, well, there being a rollout of protocol, but proper enforcement. And apart from enforcement, I like what Lagos is saying, there need to be a kind of, if some people are not being used as an example by charging them to court, I think some people will not take this serious. We need to do it, but let's decentralize monitoring. And there should be strong penalty, not just 20,000. It's a huge amount that will discourage people from breaking such protocols. And another thing I want to emphasize, the idea of 12 to 4 as period restricting movement, I don't think is adequate enough. We need to step it up a bit, maybe from 10 p.m. or so, because people naturally we expect that between the period of 12 to 4 a.m., how many people will be outside? So we need to kind of step it up a bit to maybe from 10 p.m. or so that we can actually reduce the way people are actually, moving from one part of the state to the other, or moving from this state to other parts of other states. Yes.
Okay, just before I let you go, Dr. Ganiu, briefly, can you tell us, just the way people throwing caution to the wind, do you think the state may face another lockdown?
Well, there's nothing possible, especially if the cases keep on rising. And if people continue to break some of these protocols, that may be need for that. It's not only even Lagos State. Even other states have been saying that for instance, which of the Ekiti are many other states. So even Rivers State just said something like that if people continue to break the protocol, there may be need for lockdown. It's just, I'm just weighing it. Already the economic is not in a good shape. For us to now do a total lockdown, that may complicate a lot of issues. You know what happened during that first phase where we have the 1 million boys? So we don't have a situation whereby there will be breaking law and so on. So I think we can still achieve some level of compliance if we engage the community. And as I said earlier, let decentralize, let the local government, undo some of these things so that the state can supervise. That will be a kind of synergy between the local government and state so that it will be a continuous process, not a one-off thing. It's only when something's happening, they get there and quickly, when the damage has been done, that is when they log the event center and so on. So it needs to be a continuous process. And apart from that, there should be proper engagement, just like what we did. And we need to step up our, community enlightenment, sensitization, all the risk communication we are doing. We need to, because people in the community, they don't know what they are talking about second wave. So we need to start doing that. And through that process, I think we can achieve some remarkable success in containing the virus.
Public health physician Dr. Jamiu Ganiu, a pleasure sharing your thoughts with us on the program. And Merry Christmas as well.
Same to you. Thank you. Yeah.